during that time. And once the revascularization is done, the blood flow is restored to the heart. The heart starts picking up in another, few hours, 6 to 7 hours, the heart improves, and then we take out this device. So these are the ways, we can really take care of very sick patients, very elderly patients who cannot be taken up for. And this is the result of that patient. As you can see here, the angioplasty was done, and stents have been implanted. There were 5 or 6 stents which were implanted in this patient, and the patient improved in a few hours' time. And the
Excuse
patient
me,
was then subsequently
Praveen, would
discharged.
you like to conclude in 2 minutes, please?
Yes, certainly. So this is how we are really helping our patients of cardiogenic shock, of multi-vessel disease, and patients with unstable angina also. Again, it has been shown that if you do angiography and intervention in these patients, it is far more effective than just treating them with medications. So basically, the technology is really improving. It is helping us, and the only problem is that the costs are still high. And in this situation, I can only say that our patients, we have to educate them, we have to inform them, and of course there will be so many ways of treating these patients, but certainly very sick patients and those who need these kind of therapies must be recommended. And stress of, as you can see here in this cartoon, my doctor told me to avoid any unnecessary stress, so I didn't open his bill. So that is a problem, but certainly over a period of time, the costs are going down, and of course our society is able to take care of these patients. Thank you very much.
Well, thanks, Praveen. That was, sorry, you were saying something.
No, just any questions or any?
Yeah. That was a wonderful and most eloquent synopsis of the interventional cardiology scenario. You started with that it is rather amazing that an interventional cardiologist is speaking and the 2 cardiac surgeons are watching. Praveen, chori to chori karta hai, police wale to dekhte hi hain. Over to my co-chairperson to conduct.
Yeah, it was, actually a very excellent presentation and all inclusive. But I would like to ask you that in this bleeding episodes, if it occurs within a year, would you like to stop aspirin or this clopidogrel in a patient who has drug-eluting stent?
Yeah,
if he has some bleeding episodes.
That's a good question. In fact, a dual antiplatelet therapy, which means that the patient has to be put on aspirin plus clopidogrel therapy if a patient has received a drug-eluting stent for at least 1 year. However, at the same time, I must say that most of our patients are receiving that for more than 1 year, maybe 2 years or 3 years. Especially with the previous generation of drug-eluting stents, it is being given for many years, but now the newer generation of drug-eluting stents we give for 1 to 2 years, and now there are stents. Whenever we have a patient where we suspect that this patient will be needing some kind of surgery like cataract surgery or abdominal surgery or any cancer surgery, then these days we use a stent which only needs antiplatelet therapy for the first 6 months, because they have a bioabsorbable polymer on the stent. And those are the cases where we, especially a very elderly patient, like 80-year-old patient, we will use a stent with a bioabsorbable polymer. So it doesn't need to take antiplatelet therapy for a long time. But yes, your question about bleeding, if somebody has a bleeding, we see whether the bleeding is life-threatening or not. If it is a minor piles bleeding, we don't worry about it. We treat that problem. But if it is a major bleeding, leading to loss of hemoglobin, then we have to stop one of those antiplatelets first. If it still doesn't work, then we stop both. And then, of course, we have to weigh the risks and benefits of this intervention versus this bleeding problem.
Thank you, Dr. Praveen Chandra, and thank you, Dr. Yadav and Dr. Khanna. I'll request, can I request Dr. P.K. Julka to please come here, and Dr. Rohini Handa. I just saw him here, Dr. Handa, to present a memento to our moderators. So first of all, I'd like to present a memento to Dr. O.P. Yadav. And to action replay. Dr. Khanna. To please stay here and join us back at 5 o'clock. You will have to be here. All the speakers will be, they will have to be here at 5 o'clock in a special function, and they will all be owning in a special function. There will be 3 short talks now. One will